Welcome back to another Score Builders question and answer video session. This video provides members of the Score Builders team with the opportunity to explore challenging multiple choice examination questions with students actively preparing for the licensing examination. My name is Scott Giles, and I will be your host for today's journey. I will read the question and provide you with an additional 60 seconds to answer the question. Ready? Let's go. A patient diagnosed with schizophrenia has been taking haloperidol, Haldol, following an acute psychotic episode. The physical therapist should be alert for which of the following side effects most commonly associated with this medication. Option 1, facial grimacing and involuntary extremity movements. Option 2, significant weight gain and elevated serum lipids. Option 3, constipation and urinary retention. Option 4, respiratory depression and orthostatic hypotension. Haloperidol, Haldol, is a traditional antipsychotic medication. The most common side effects associated with antipsychotic drugs are extrapyramidal symptoms, which are abnormal movement patterns such as dyskinesia and dystonia. Therapists should be alert for changes in the patient's posture, balance, or movement pattern and notify healthcare personnel immediately. Early detection of these effects can allow for prompt medical and pharmacological management to help diminish the risk of long-term motor dysfunction. Let's explore each of the options. Option 1, facial grimacing and involuntary extremity movements. Facial grimacing and involuntary movements of the extremities are examples of involuntary, repetitive body movements commonly observed in patients taking traditional antipsychotic medications such as haloperidol, Haldol. These extrapyramidal symptoms are characteristic of tardive dyskinesia, one of the most concerning side effects of traditional antipsychotic agents since it may be irreversible. Tardive dyskinesia typically involves the orofacial muscles, for example, lip smacking, facial grimacing, tongue protrusion, but may also include chorioathetoid movements of the extremities and dystonias of the neck and trunk. Option 2, significant weight gain and elevated serum lipids. Significant weight gain and elevated serum lipids are metabolic side effects associated with the newer, atypical antipsychotic medications such as Clorazil, Abilify, and Respiratory. Although these atypical antipsychotic medications have a decreased risk of producing extrapyramidal symptoms such as movement disorders and motor side effects, they can produce side effects that ultimately result in cardiovascular or metabolic disorders. Option 3, constipation and urinary retention. Medications with anticholinergic properties produce side effects that include constipation, urinary retention, confusion, and arrhythmias. Tricyclic antidepressants, such as Elavil, have significant anticholinergic properties. Option 4, respiratory depression and orthostatic hypotension. Respiratory depression and orthostatic hypotension are side effects associated with opioid analgesics, narcotics. Opioid agents provide analgesia for acute severe pain management. The medication stimulates opioid receptors within the central nervous system to prevent pain impulses from reaching their destination. Respiratory depression can be severe or fatal in patients who are seriously ill, have pre-existing pulmonary conditions, or in cases of overdose. The correct answer is option 1. Is life fair? Does this question make you ponder the fairness of life? Your exam will include questions that are surprisingly basic and questions that are shockingly specific. This particular question falls into the shockingly specific category. Be grateful for the basic questions and roll up your sleeves and battle through the shockingly specific questions. Remember, every time you eliminate one or more options, the probability of answering the question correctly dramatically increases. Let's explore the all-student data. 57% of students selected option 1, facial grimacing and involuntary extremity movements, the correct response. 5% of students selected option 2, significant weight gain and elevated serum lipids. 8% of students selected option 3, constipation and urinary retention. 30% of students selected option 4, respiratory depression and orthostatic hypotension. System classification. This question is an other systems question, which represents approximately 21% of all exam items. Content outline classification. This question is a foundations for evaluation, differential diagnosis, and prognosis question, which represents approximately 33% of all exam items. Level classification. This question is a level 1 question since the question requires students to possess basic foundational academic knowledge. Remediation of level 1 questions occurs through academic review of entry-level content using textbooks, review books, Basecamp, and flashcards. Academic focus area. Looking to review related academic content? Check out pages 578 through 579 in NPTE Exam the Complete Study Guide. Thanks for joining us on the Score Builder's question and answer video session. See you next week.